Mindfulness originates from the Buddhist teaching and relates to being psychologically aware. So when an individual is in a mindful state, they are present in that moment without a focus on any particular thoughts, feelings, emotions, or external factors. So mindfulness has grown in popularity in recent years and has been found to be a common self-care practice now. There is now greater accessibility to mindfulness. For example, you can engage in it short-term or long-term, or you can engage through a range of different modalities, including online, in-person, or through the use of an app. Mindfulness has been shown to improve well-being throughout the research. For example, it helps to slow down the breath and heart rate, which links to reduced stress and anxiety. It also allows individuals to become more aware of thoughts, feelings, and emotions, which gives them a greater sense of self-awareness overall, and this has been linked to greater resilience. Trainee counsellors are subject to high levels of pressure and stress. For example, from the research, this has been demonstrated to be due to pressures managing client work, meeting deadlines, and financial struggles, and as a result, this can put their well-being at risk. Therefore, it is important for them to manage their well-being through self-care. One way they can do this is mindfulness. So the use of mindfulness engagement for well-being benefits in trainee practitioners and counsellors has been demonstrated throughout the literature. So there is a lot of research support to show that mindfulness helps to improve their confidence, boost their mood, and reduce their stress and anxiety. This is relevant to different modalities of mindfulness, which has supported the use of in-person and online mindfulness engagement for trainee practitioners' wellbeing, with some consideration of trainee counsellors. Now, there are gaps in the research as there is a lack of research comparing in-person and online mindfulness to benefit trainee counsellors' wellbeing, and also the research out there related to mindfulness in general related to wellbeing has not always considered trainee counsellors, particularly for online mindfulness interventions. So the aim of this study was to compare the effectiveness of two different modalities of mindfulness, which included in-person mindfulness and pre-recorded mindfulness, based on their effectiveness in improving trainee counsellors' wellbeing. Now, we had two hypotheses for this study. The first hypothesis was that both the in-person and pre-recorded mindfulness task would effectively improve trainee counsellors' wellbeing after the mindfulness engagement. And the second hypothesis was that trainee counsellors' wellbeing would demonstrate greater improvements after engaging in the in-person mindfulness session compared to after engaging in the pre-recorded mindfulness session. The study involved 50 trainee counsellors aged 21 to 53 years old. All participants were first-year master's students studying counselling at Bangor University. They were obtained through opportunity sampling as they were invited to take part via the course. This study's research design was a 2x2 repeated measures design, as all participants engaged in all levels of the independent variables. The first independent variable was time, which included two levels of before and after mindfulness engagement. The second independent variable was mindfulness modality, which included an in-person mindfulness session and a pre-recorded mindfulness session. The dependent variable was psychological well-being, which was assessed using the psychological well-being questionnaire. This included 18 questions which were completed online, and participants responded to each item using a 7-point Likert scale, ranging from strongly agree to strongly disagree, and a total wellbeing score was calculated for each participant. Participants engaged in 2 mindfulness sessions as part of the study. One was an in-person mindfulness session and the other was a pre-recorded mindfulness session. Both were 30 minutes long and based on mindfulness-based cognitive therapy and included seated guided meditation. Both sessions had the same content which ran in the same order and were conducted by one of the researchers who was a trainee mindfulness instructor. During the in-person mindfulness session, the mindfulness instructor guided the participants in person, and for the pre-recorded mindfulness session, participants were presented with an online audio recording of the same instructor talking them through the session. Both sessions were completed during a university workshop, and the study ran over 2 weeks. During 1 week, participants engaged in an in-person mindfulness session, and during the other week, participants engaged in the pre-recorded mindfulness session. Before engaging in both mindfulness tasks, participants completed an online questionnaire to assess their well-being. Participants then completed the questionnaire directly after engaging in both mindfulness sessions, which assess their well-being and experience of the mindfulness tasks. The study adhered to the BACP guidelines for ethical research and practice. Also, the study was approved by the Bangor University's ethics team before it was conducted. So ethics was a priority throughout. Particularly informed consent was required from all participants before they engaged in each questionnaire. Participants were also reminded throughout of their ability to withdraw. Now, there are minor risks related to mindfulness engagement, including the potential increased awareness of uncomfortable and difficult thoughts, feelings, and sensations, which can cause some individuals distress. Therefore, in the information sheet, this risk was disclosed, and any participants who felt that mindfulness may cause them distress were not recommended to engage in the sessions. Support was also provided by the research team throughout the mindfulness sessions in case any of the participants felt distressed or uncomfortable. Debrief forms were also presented to participants after completing the final questionnaire, which informed them of the true aims of the study. 17 participants were removed from the study due to incompletion of questionnaires. The data was assessed using a 2-way repeated ANOVA. When looking at the main effect of time, the results demonstrated that participants' mean well-being scores were greater after mindfulness engagement compared to before. However, from the ANOVA, it was evident that differences between scores before and after mindfulness engagement were insignificant. This is shown from the F statement provided, as the p-value was above 0.05. When considering modality, participants' average well-being scores were greater for pre-recorded sessions compared to in-person sessions. But again, the F statement showed an insignificant main effect of modality on well-being. Lastly, we considered whether there was an interaction between modality and time based on their influence on well-being. Figure 1 helps to show this interaction, and it demonstrates that well-being scores did increase after engaging both the pre-recorded and in the in-person mindfulness sessions. A greater difference was shown for well-being scores after in-person engagement. However, again, the ANOVA demonstrated an insignificant interaction between modality and time based on their well-being influences. Based on participants' feedback from both mindfulness sessions, common themes and descriptions were identified. So the most common description used by participants was relaxing, with 35 participants stating that they felt relaxed. Alternative common phrases included calming, soothing, and peaceful. Participants also described the session as good, great, and beneficial, and mood benefits were identified by many participants. Alternatively, there were descriptions which indicated struggles and dislikes. So the most common struggle was difficulty staying engaged and paying attention. Also, many participants stated that they felt sleepy or even fell asleep, and there was also critiques of the environment, with participants not liking the room temperature, the chairs provided, and the classroom setting. When it came to comparing the different sessions, 7 stated that they preferred the in-person session and 2 stated that they preferred the pre-recorded session. Overall, this research project found that trainee counsellors' wellbeing improved after engaging in both pre-recorded and in-person mindfulness sessions. However, these changes were insignificant. Therefore, such results contradict both hypotheses, as mindfulness had minimal impacts on trainee counsellors' wellbeing, and wellbeing changes did not differ depending on the mindfulness modality. It is important to consider participants' descriptions and experiences of the sessions, as a majority of these reflected enjoyment and personal gains, for example, mood benefits and feelings of relaxations. Such positive feelings and emotions evoked can help to increase a person's awareness and benefit their resilience, which has been linked to greater functioning and well-being. Discrepancies between the current findings and previous literature may relate to the differences in target populations used, as much of the previous research has focused on other trainee practitioners who have different responsibilities and therefore experience stresses differently. And research suggests that the effectiveness of self-care can depend on the type of stress and how it manifests. Alternatively, much of the literature investigating mindfulness for well-being benefits are based on longer-term interventions. Therefore, for significant well-being benefits to trainee counsellors' well-being, long-term engagement may be required. There are limitations to this study, as it was a repeated survey. Therefore, memory effects could have impacted the results of these, as these have been shown to be a source of bias, as participants may unconsciously give the same response. Additionally, participants may have experienced boredom due to completing the same questionnaire 4 times, which may have explained the incomplete questionnaires. Overall, this study has added to the existing literature, as it has investigated and compared different modalities of mindfulness in the context of trainee counsellors for wellbeing benefits, and this is neglected in previous research. Therefore, it's provided a greater understanding. It has also helped to understand that maybe there is no difference between online and in-person mindfulness for wellbeing engagement. When it comes to future research, this could consider in-person versus pre-recorded mindfulness engagement for trainee counsellors, but over a longer term period. The take-home message from this study is that when trainee counsellors engaged in mindfulness sessions, this elicited positive feelings from many. Therefore, it may be a beneficial self-care tool. Additionally, as we found that interacting with mindfulness online seems to be no different to interacting with it in person, this may be beneficial for trainee counsellors, specifically due to their busy schedule, as online engagement can be quicker, cheaper, and easier to access. Thank you for taking the time today to listen to my presentation on my research project investigating different mindfulness modalities for trainee counsellors wellbeing. If you have any questions or queries, please put them in the comments section below and I will answer them to the best of my abilities. Thank you.